What are some of the signs that indicate that your partner may secretly be looking at porn? First off, I just want to say that I'm a licensed counselor and also a certified sex addiction therapist. In no way, shape, or form am I giving you advice in your relationship, but I do want to talk about some of the common things that I normally see. So I just want to cut to the chase and get right to the point. First thing I think is the obvious one. If you see unusual activity on the computer or your history may be deleted, that kind of thing, it may be indicative that something's going on. And I think one of the things is to specifically look at the history. If it's kind of cleaned out or it's cleaned out regularly and you're just not sure why, if it's on your account, for instance, that is something you really want to pay attention to. Now, I'm not saying be secretive or anything and just like go snooping and set the other person up, but I am just saying to look for patterns. And, usually the history is something that if someone who's addicted may clean that out regularly just because, they don't want to get caught. So that's something they do regularly. Second point, there's a lot of secretive behavior going on. Now that could really range from just, keeping secrets about small things, obviously keeping secrets about big things. There could be some secretive type of just behavior, whatever that may be. The thing you got to look for here is, secretive behavior surrounding like online usage, whereas like maybe you have an app that you're questioning your partner about, and they're like, no, there's nothing going on there. But then you see that they maybe have deleted it and then it shows back up. And then there's some secrets around that, right? So it just, that could be a sign and something that you really need to, confront and probably, get some help with to be able to confront that in a healthy way. So the third thing that I mentioned is just increase in irritability. And you see this sometimes with someone who may want to go do something and, they're just not going to be able to. For instance, they're coming home from work and then maybe you're home early and that was not in the plans. It wasn't communicated. And then there just may be some irritability there. And, it's situations like that. I could sit here and go on, but it's just one of those things that, you can pay attention to and start to get some insight. But I do want to say, just because someone's irritable doesn't necessarily mean they're looking at something. We live in a really tough world. So it could be one of those things that, they're just really struggling at work or, that kind of thing. But on the flip side, irritability and frustration and just high levels of stress are one of the biggest factors in, looking at pornography in the first place. So you need to really, just kind of keep in mind, honestly, and all of these points that I'm making, healthy communication and communication in general, just to be able to get the truth out on the table is really what's needed. Okay, so the fourth thing, poor performance at work. Now, you might not be able to see this specifically, but I do think that it's really important to look at. Okay, so the fourth thing is poor performance at work. You may not be able to see this specifically, but if, there's just some stuff going on and maybe there's a lot of, slacking on the job, write-ups, that kind of thing, just issues at work, what could be going on. And what I have seen before is, usage at work, specifically for people who may work overnight shift or just, maybe have some times where there's a lot of downtime at work. Usually, there's need to fill that time. And so, if you see patterns in performance or, they're talking to you about some performance issues and it just doesn't make any sense. It could be a lot of things, but it is something that I see frequently in working with people. So just keep that in mind. And so the last thing that I want to mention is insomnia. And so just inability to go to sleep. One of the things you might want to look for is if your partner is just not able to really go to sleep with, maybe without sex or, without the ability to go and look at something. So, that can become really habitual because you got to look, when you look at the sort of the neurological effects, right? Like there is a dopamine release whenever you engage in looking at pornography and, incorporate masturbation. So it's one of those things that, can lead to insomnia, especially if it's an addiction. You're needing that release in order to be able to, really get some rest. So anyway, look, these are just 5 things. There can be 10, 20, 30, 40, 50, but there's just 5 things that I kind of see frequently. But anyway, whatever you take away from this video, I just want to encourage you that having someone to bounce off some of these things, if you're concerned, go to a professional, go to a CSAT, go to someone who knows, how to navigate some of this stuff, and, don't just navigate it alone. Just because you go see a therapist or someone who is trained doesn't necessarily mean that you have to slap the label on, but it does mean that, you don't have to navigate it by yourself. So I know that this whole thing is really, just tough to hear. And for those of you watching, you're probably in a situation where, you're really just concerned and you're just not really sure how to handle it, so just don't do it alone. So anyway, if you've gotten anything out of this video, I'd love to know in the comments, and don't forget to click that subscribe button, because I really do enjoy doing these videos just to try to help. Gotta claim here that this is educational only. This is not therapy. This is not something where I know your personal situation. So if you need assistance, definitely seek someone out in your area and go talk to someone. Don't sit with this by yourself. So again, click the subscribe button. Would love to hear from you, and I'll see you on the next one.